Hello everyone, welcome to our Facebook Live session. Let's talk health. We are in the episode 16 and today we have with us Dr. Praful. He is the robotic knee replacement specialist at Citizens Hospital, Naladandla, Hyderabad.
Hi.
Hello doctor.
Hi.
Um, so we know about the knee replacements and we've heard about a lot as what are the causes, what are the precautions and how it's being done. However, if a knee replacement fails, what we need to do. So in this episode of revision knee replacement, let us ask our doctor about the causes and the risk factors for a failure of a knee replacement.
So when we talk about what is the risk factors or the causes for a failure in the primary knee replacements, one of the major cause is infection. So here the infection can be a localized infection at the surgical site, or it can be a systemic infection which is generally occurs in the body, like urinary tract infections or any respiratory tract infections due to the organisms which are already systemic, which means that it's already running in our blood, can just go and settle in on our implants, which are foreign body, and they can cause localized infection at that foreign body structure. So one of the common causes is a systemic or a localized infection at the primary knee replacement site. And second cause is aseptic loosening, because a term of aseptic loosening, as the term suggests only, it is like implants gets loosened off. Why it gets loosened off is because it can be a porosity of the bone or improper implantation at the time of the surgery, or sometimes there can be no reason at all. And it has been evidently proven also, aseptic loosening, it can be most of the time, it can be either by idiopathic, means there can be no apt reasons why it has got loosened, but one of the most common reasons is bone porosity and the biology of the local bone contributing to that loosening. So after covering the aseptic loosening, the third cause is it can be because of the fractures which are occurring at the knee replacement site. And sometimes if the fracture doesn't heal when it is adjoining to the knee replacement site, it can cause a lot of pain and a lot of trouble for the patient to ambulate. So thereby again contributing for the revision surgery of that primary knee replacement.
Right.
So in overall, three major risk factors or three causes for the revision knee replacement is infection, aseptic loosening, and fractures. And what are the risk factors of causing these conditions can be diabetic conditions, which we see normally, can be rheumatoid patients, when the patients are chronic steroids, or it can be like patients who have osteoporosis, like patients who don't get treated for osteoporosis also, they have this tendency to have fractures with a normal simple falls.
Doctor, would you enlighten us about what are the signs of failed knee replacement?
So when we say that when a knee replacement is failed, not commonly what we see in the patients, the sign and symptoms is, the first symptom any patient comes to our OPD is pain while walking.
Okay.
And that pain, it generally, post-surgical pain generally fades off within 15 days or a month. But the continuous pain or any debilitating pain for a patient post-knee replacement while doing the daily living activities is one of the first symptom any patient will have when they have a knee replacement done. Generally, it can be 3 months post-surgery or 6 months post-surgery. It can be subjective because the pain is very subjective. The second common symptom when we see is when the patient is having infection. So when patient will have this swelling of the joint, sometimes it can be a discharge wound around the knee replacement site. So these are the very telltale signs which can just say that this failed. But generally the silent signs are pain while walking, decreased movement at the joint, or movement of the joint causing pain in the daily living activities, or patient is not aptly satisfied with the knee replacement, thereby saying that I am not able to do my daily living activities following knee replacement because I cannot bend the knee properly. If I do excessive bending, I'm having pain, or I can hear some clicks or clunks while bending the knee. These are the one of the common symptoms which are told by the patient that my knee replacement is not up to the mark what I expected. So, overall to say, patient having pain while doing daily living activities, patient having pain moving the knee joint post-surgery, patient having clunks, clicks while doing the movement, or sometimes patients saying that I'm just having local rise of temperature or the warmth at the knee joint whenever they say. These are the symptoms. And the signs what we see to say that the knee replacement has failed is like, as I told you, suture line or the wound is it's not healed properly, or there's a lot of redness around the knee joint, or there is proper, what you can say, that loose joint, like it's not sturdy enough to individual to bear the weight. Or sometimes we can see that just telltale signs, as I told you before, a sinus or a wound discharge, which is a telltale sign to say that it is infected. So, that the major symptom or any sign for a failed knee replacement is pain post-surgery.
Understood, doctor. Thank you. Doctor, how is a failed knee replacement treated?
So, the failed knee replacement treatment is dependent upon what is the cause of the failed knee replacement. Now, if we divide what are the causes, I told you what are the causes. Suppose the cause of a failed knee replacement is just like a minor tissue which is causing clunks or clicks in that. It can be managed by keyhole surgery, just arthroscopic way. Sometimes if the pain is mainly of an inflammatory cause, or it is like minor inflammation occurring in the joint, it can be treated by non-surgical methods, just by medication. Or if it is just by simple what you call muscle strengthening exercise, also sometimes can be used for the failed knee replacement to be treated. Again, dependent on what is the cause of the failure. But in a broad way to tell what is the treatment plan for any failed knee replacement, I would divide in a non-surgical method or minimal invasive method and a proper invasive method surgical options. When we say non-surgical methods, it can be either by antibiotic coverage and empirical medications and physiotherapy.
Okay.
And second category would be minor procedures or minimal invasive procedures like arthroscopic procedures, where we see around the kneecap a tissue forming around and patient is having pain while bending the knee or having some clunks and clicks. We take it out by arthroscopic keyhole procedures. Now, coming to the third category, which is the most of the time we see in a failed knee replacement, is invasive procedure. Now, in that invasive procedure, it can be a two-stage procedure or a single-stage procedure. And as I told you before, again, it is dependent on what is the causing factor for that. So suppose if it is an infection, then in general, most of the 90% of time, we do two-stage procedure where we take out all the implants which have been infected and all the tissue which has been infected and give a very sterile joint for a few days and see that the whole body is a non-infectious zone and go for secondary replacement procedure of the knee joint. That is two-stage procedure. And this procedure generally is dependent on how is that infection has been eliminated from the body. And there are a lot of biochemical markers. We see that and we proceed upon. Sometimes it can be 6 weeks, sometimes it can be 3 months, sometimes it can be 4 months for the second. It is, as I told you before, how well we are dealing with the infection stage and getting the patient into the non-infective zone. Now, that is in regards to the infection causing failed knee replacement. Now, suppose if it is the causative factor is the implant loosening, then we can go for a single stage procedure of a revision knee replacement. We don't require two-stage, but we need to confirm that it is non-infective. So there are various methods to confirm just by synovial tap, like we take a synovial tissue and send it for the pathological and microbiological examinations. And or bone scan, which is a non-invasive method. There are methods like this, where we confirm it is not because of infection and we go for single-stage revision knee replacement, thereby cutting down the time for the patient to come to recovery. Now, that is in regards to aseptic loosening. And the third case scenario, as I told you, is in regards to fractures.
Okay.
When fractures happen, we try to retain the parent bone as far as possible, so that the natural bone is but if that bone is very osteoporotic, and if the bone is not contributing much to that implant, we generally try to excise that bone, fractured bone out, and give a replacement, revision knee replacement for that patient, where we build up the stock of the bone which we taken out and put a new joint,
Right.
thereby cutting down the patient recovery period. So in an overall way to say, the treatment range is from non-surgical, minor or minimal invasive surgical procedures, and a proper invasive procedures, which can be a staged or a single procedure.
Well, understood, doctor. Doctor, what exactly happens during this revision knee replacement?
So basically, as I told you before, in a revision knee replacement surgery, what happens or what methodology will be followed will be again be dependent upon the causative factor. Now, in general, most of the time, revision knee replacements we come across here in this part of the town or this part of the country is mainly because of infections.
Okay.
Okay. So in a broad way to say, an infective primary knee replacement failed condition, we go for two-stage procedure. First, we try to control the infection by taking out all the infective material out of the knee joint. That includes the implant, the parent bone, the tissue, everything.
Okay.
So whatever the tissues have been compromised, we take it out and put a cement spacer, which is an antibiotic cement spacer, which tries to fight the organisms which are locally settled in that joint for 3 to 4 weeks or sometimes to 6 weeks. Following the confirmation that the joint is sterile or non-infective, after 6 weeks, we take out that cement spacer and apply a actual knee replacement processes, which is aptly made for that, specifically for that patient. Now, this is for the infective failed knee replacement. Now, coming to aseptic loosening patient or patient with fractures of a primary knee replacement done patient is, we go in, we see what is the loosening which is happening, and reconfirm that it is not an infective loosening which is happening. And on confirmation that it is not infective, we just take out the implants, see what is the bone stock which is available, parent bone stock available for us to work on. And if it is actual bone stock, we try to preserve as much as possible, but again, not at the cost of viability to that patient.
Right.
So we try to retain as much as that. If it is non-retainable, we'll try to excise it and go for specific for that person a revision knee replacement processes, and try to build up the bone from thereupon and the joint, and give a good movement intraoperatively and come out. If the revision knee replacement is, the condition here has been caused by the fractures, we try to see what is the fracture viability. If possible, try to fix that fracture and try to avoid the revision knee replacement. Or else, if it is not fixable, the viability of the bone is at question, we again remove that, excise that normal bone or the parent bone which is not viable, and go for specific modular processes which is required for that patient.
So, what exactly does the doctor do prior to the revision knee surgery?
So, before going for any revision knee replacement procedure, we ascertain what is the etiology or what is the cause for that trouble for the primary knee replacement, and try to confirm that diagnosis.
Okay.
So, for again, as I told you, if it is an infective, we do a synovial tap, we do a bone scan, we check our biochemical markers, and come to a conclusion and come to the diagnostic conclusion. Yes, this is the causative factor for that. Suppose on the confirmation of that causation, suppose it is comes as a infective, we try, and the patient is suppose is a diabetic, and patient is having other comorbid conditions like asthma and cardiac conditions and everything. We try to optimize those. Like suppose patient is diabetic, we try to get the HbA1c below 7 or 6 in a high, trying to get a good control over that diabetes first and go for procedure.
Right.
And that is for infection. Now coming for other cases like patient is a fractured patient or patient is having fractures, we try to confirm that patient is osteoporotic or not. There are various methods to confirm on osteoporosis. And second, the third thing is we reconfirm our diagnosis that patient is non-infective. Like I told you previous, yes, first is confirmation whether it is infective. Though before going to surgery, suppose we have a case of a aseptic loosening of the knee joint, we again reconfirm with our biochemical markers like C-reactive protein, procalcitonin. These are the biochemical markers we generally see for the confirmation whether it is infective or non-infective. So overall, what do we do before going for surgery is first confirmation of the diagnosis, what is the causing factor, and how well we can optimize the patient for the surgery.
Great. Thank you. Doctor, what should we expect after knee revision surgery?
So how do we see ourselves that the revision knee replacement is being successful, or what does patient look forward after having a revision knee replacement, or what we look forward is first thing is healing of the wound.
Right.
As we say, as I told you, one of the most common causes is the infection. And post revision knee replacement, the wound healing is the most important factor for us. And the wound has healed, that means we have 50% of the time we are out of the wounds.
Right.
And the second thing is pain. Because as I told you, most common symptom of any revision, pain knee is pain. So generally after 4 to 5 weeks, or dependent upon what is the kind of surgery the patient is undergoing for the revision knee replacement, we would like to see the patient ambulating on his own or doing his daily living activities on his own without having much pain. And third thing is painless range of movement of the knee joint, which one of the another causes for the revision knee replacement patient. So we would like to see that movement of the knee joint is pain-free and hassle-free.
Right.
But as a word of this thing, patient, when he compares the revision knee replacement joint to his normal joint, he may have small loss of movement. Again, as I told you, it is again dependent upon the causing factor of the same knee replacement. But most of the times, they may have some deficiency compared to a normal knee replacement joint.
Right. Thank you, doctor. Thank you so much for your valuable information about this revision knee replacement. It's a wonderful session, a lot of information that we have. Thank you, viewers. I'm sure you would enjoy this session and have a wonderful day ahead.